Hello, thank you for joining us again. I'm Dr. Hussein Abbas, the Medical Director of the Bariatric Programs, both at Memorial in Jacksonville and at Memorial Satilla Hospital in Waycross, Georgia. It's an absolute pleasure. It's an absolute pleasure to have Miss Lynette with us today, and we're just going to be asking about her journey through the whole process, and hopefully she'll answer some of your questions. And really, she's walked the walk. She's actually been through this. And so, without further ado, Ms. Lynette, I've got a few questions that I obviously, kind of like prepared, which I hear a lot from patients, and I wanted to ask you. First thing is, why don't you tell us a little bit about your journey, and of course, what made you decide to have weight loss surgery?
Okay, nice to be asked to be here, thank you. I actually have been overweight my entire life, and one day I've thought about the surgery for a long time, and I'm a nurse, and sometimes ignorance is bliss, and we see what can go wrong, and I put it off because of fear. And it was November 11th of 2019, and you actually gave a class here and at Memorial Hospital, and I decided to come, and I felt like I was at church, like you were talking to me about weight loss. I tried Weight Watchers and Jenny Craig through my whole life, and I would have success, and then I would yo-yo and gain more than I had lost.
Right.
So being at your seminar was basically life-changing, and I was going to be, or I turned 50 in December of 2020, and I knew in my mind when I turned 50, I wanted to be healthier. So I decided that it was time.
That's great, and that's actually, this could not be put more eloquently, and that's exactly it. And which takes me to the next question. What do you think are some of the prejudices? Because as you said, it's not just, it wasn't just you. There's a lot of probably pressure and probably false information from others, including some clinicians. What do you think are some of the common prejudices against specifically obesity, which we don't have, say, against high blood pressure, diabetes?
Right, well, many people feel like you can just lose weight. It's like an addiction, like you can just stop smoking or just stop eating. And I really think a lot of it is hereditary. Both my parents are overweight. They both have high blood pressure, diabetes, AFib. Like, I knew if I didn't change my path that I was going to be on their journey, which, I love them greatly, but I hate to see them struggle. They're in their 70s, and, I wish they would have done this earlier. I wish I would have done this earlier so I could have been an advocate for them.
So that's actually great. That's actually very, very good points right there. It's a complex relationship. I think our food relationship, which leads a lot of people to be prejudiced against it, it's a complex relationship. It's not a simple thing of cut the amount that you can eat and you can easily lose the weight, because, as I've said before, we eat when we're happy, we eat when we're sad. Food gives us comfort. It's a lot more complex relationship with food than we have, than other people appreciate.
Absolutely.
So with that, let me ask you the question that I get, and I even wrote it in capitals here. Is it the easy way out? And you tell everybody why it's not, because that is one of my pet peeves.
It is not the easy way out. It is a tool. You have to use it as a tool. You have to take accountability for yourself and what you do and what goes into your mouth. And as you know, in the beginning, I did have complications and I needed a second surgery. And if you would have asked me in the first 2 weeks if I would have done it again, I would have said no way. But after my second surgery and trusting the process, I would recommend it to anyone. It was life-changing. I mean, I just couldn't imagine where I would be without it, honestly.
So what are some of the things, say, for example, activities? I know you are really now a gym rat now.
I am a gym rat.
And so what are some of the activities that you think you probably would, and of course, as you see your parents, you think you may have struggled before, going through this journey. And let me, before I forget, say something. All the weight loss that Miss Lynette has achieved is because of her efforts. So this is the one thing that, if you want to get me angry, you tell me it's the surgery that did that. because that is not true. And I do this for a living, and I'm what I like to consider myself to be an obesity expert, and that is not. People work very hard. And so I'll let Miss Lynette tell you what she's doing and what she's able to do now that probably was difficult for you to do before this.
I work long hours. I am actually going back for my master's, so I have more stamina. I'm a nurse through COVID, I was probably one of your last surgeries, because my
Correct.
2-year anniversary is March 18th, and so yeah, I was probably one of the last surgeries. But I go to the gym 3-4 days a week. Do I eat things that I shouldn't? Absolutely, but it's a life balance. And on days that I don't want to go to the gym, I find that I have to push myself to go even more, and they are my better workout days. And it does so much for my mental well-being as well. I don't know if I'll succeed, but this Sunday I'm actually doing a 10K on Saturday and a half marathon in Disney for the princess. It's always been on my bucket list, and if I don't succeed this year, I will sign up again next year. But I would have never thought that it would be something that I'd be doing.
Fantastic. Listen, thank you so much for coming in.
Thank you.
And it's really stories like that that keeps our program, motivated and pushes us and really allows us to do more and more. Because, when people tell me about the changes that they've made and what the small part that we like at least to think we're part of, it truly is absolutely very motivating, and more than motivating, it really is inspiring to all of us. So thank you very much, Miss Lynette. Thank you for doing this.
Thank you.